Research Unit has and continues to conduct studies related to rotavirus vaccines, including the Rotavirus vaccine, which is currently used in Zambia since 2013. The rotavirus vaccine study that we are currently conducting is entitled A Randomized Control Trial of 2 versus 3 doses of rotavirus vaccine for boosting and longevity of vaccine immune responses in Zambia. The main aim of this study is to try and assess whether a third dose of Rotavirus vaccine administered at 9 months of infant age would provide a boosted immune response against rotavirus in comparison to a 2-dose schedule. This study began in 2018 and will be conducted over 4 years. The study is funded by the European and Developing Countries Clinical Trials Partnership through a senior fellowship grant provided to Dr. Roma Chilengi, who is the principal investigator. Additionally, this study will assess a detailed immune profile of children receiving rotavirus vaccines, which include both cellular and humoral immune responses, and this work will be funded through the Wellcome Trust, through a Wellcome Trust International Training Fellowship. One of the benefits of this study will be provision of improved information on the immune responses generated by rotavirus vaccines in our infants, as well as the possibility of addition of a third dose, which has the potential to provide even more increased protection against rotavirus diarrhea in our children.
Study entitled The Influence of Maternal and Infant Histoblack Antigens on Oral Rotavirus Vaccine Immunogenicity in Zambia. So this study is basically a sub-study of a larger parent clinical trial called Rovas 2, which has been described previously. And the focus of this study is basically to assess carbohydrate antigens which are expressed in human body tissues, and the expression is varied based on our individual genetic makeups. Now, literature and the body of science has shown that certain expressed antigens are used by viruses such as rotavirus to elicit infection in the human body. And as such, rotavirus vaccines, which are live vaccines, have also been shown to mimic this type of model to elicit effective immunity in the recipients. And therefore, our aim in this study is to be able to investigate the different types of histoblack antigens that are present in our cohort of study, and then be able to associate these with their responses to the vaccination and make associations as to whether there is indeed an effect of these histoblack antigens on the immune responses that the infants mount. Now, so far the results do indicate that we have indeed different antigens in our population, and we would like to carry on further investigations that are going to give us immunological data from which we'll be able to make associations and be able to make recommendations. So this study is important in one respect, in that it's going to add to the body of science on this study, which has been an area of interest in research. And secondly, it's going to provide a basis from which we can be able to inform policy regarding the administration and use of these vaccines in our local setting to ensure that our children do receive and realize the maximum benefits intended by these vaccinations.